Hello, I'm Anita, and this is Care Experts, brought to you by CareCredit. The CareCredit credit card can help you get the look you've always wanted now. CareCredit is offered at hundreds of thousands of locations nationwide for things like cosmetic surgery, injectables, and other beauty procedures. Today, we're in Los Angeles, California with Dr. Shirley Soleiman. Dr. Soleiman is a board-certified physician and injectable specialist and the founder of the Cosmetic Injectables Center in Sherman Oaks, California. Today, we're talking about injectable vitamins and IV therapies. So what exactly is an injectable vitamin?
We're all familiar with vitamins that you take orally at home on a daily basis, right? But an injectable one is just either it's in a syringe and you inject it into the muscle or the fat, subcutaneous or IM, which is intramuscular, or you can put it inside of a normal saline bag and drip it into the bloodstream, which also creates some hydration.
Why exactly would someone need vitamin therapy?
So we have the actual everyday vitamins that you can take orally, but there are people who have potentially some gastrointestinal absorption issues. So instead of it going indirectly through the esophagus into the stomach, through the acid of the stomach, and then going across the wall into the bloodstream, you can just directly put it either into the muscle or into the bloodstream. So it's a little bit quicker of an onset when you go direct and when you bypass that, and there's less possibilities of having deficiencies in terms of absorption.
What is the most common reason that people come in for vitamin therapy?
It varies, of course. And so we've got people that are on a weight loss program and they need a lot of B12. There are people who potentially have had a little too much to drink the night before and they just want to be hydrated.
Yeah.
There's the immune system boost, especially with COVID and other infections that are going around. People want to just boost their immune system. There is just skin looking better, hydrated and looking more shiny. And then there's things that go along with each of those. If there's pain or if there's nausea, stomach problems, we can then mix medications in those. And so those are other reasons people come in for these type of treatments.
And what exactly is the difference between vitamin injections and a vitamin drip?
So vitamin injection is a little bit more concentrated. You can't really put a concentrated vitamin in directly into the bloodstream because there's things like pH balancing, concentration issues. You don't want to overwhelm the body and cause maybe too much of electrolytes in any which manner. So if you're going to do a direct injection, usually you put it into the muscle or into sub-Q, which is under the skin, into the fat area, and then you depend on slow absorption over time. Or if you're going to put it directly into the bloodstream, you want to then maybe mix it with some normal saline, which then reduces the concentration so that you could go directly into the bloodstream.
How long does vitamin therapy take to get the full benefit from it?
If you're trying to get a deficiency rectified, then you may need several injections. There are people who are deficient in vitamin B12, for example. And so that can take weekly sessions to get that done. As far as the duration of treatment on site, it takes about a half hour. You could do it with maybe a half a liter, or depending on how much of normal saline that's being injected, that determines how long the treatment might be. And then there are people who just want a little bit of a boost in their vitamin concentration. Let's say they're not deficient, they just want it to be a little bit increased. And so the amount of repetition or length of time that it takes is really individualized based on each person.
We'll be back with more Care Experts after this brief message.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back to Care Experts. Let's continue our discussion on injectable vitamins and IV therapy. And how long after starting vitamin therapy would a patient feel the benefits from it?
Again, that depends on which vitamin is being introduced. If you are just looking for rehydration, let's say, for example, again, you have a hangover, then that would be pretty immediate. If you're inserting medications into that, things like if you have body aches from working out, or if you're nauseated and you need medication for that, again, that's pretty quick. But if you're trying to reestablish maybe a vitamin deficiency, you may need repetitive treatment, and that might take a little bit longer.
Are you able to use vitamin therapy in terms of helping your skin? Is there like a specific vitamin you'd want to do if you're trying to achieve maybe more glowing skin or something?
Absolutely. I think vitamins in general work in so many different pathways in the body. I don't like when people just hyper-focus on one vitamin.
Okay.
Yes, there may be more vitamin usage, such as vitamin C or vitamin E into the skin, but overall, all of our cellular functions, our immune system, everything, they work with each other, and so it's important to really have a good balance of vitamins in your body, and especially hydration as well.
And can you talk to me a little bit about the cost for injectable vitamins, maybe versus vitamin IV drips?
There are drips such as stem cells that could range all the way up to $7,500 or $10,000. And then there are just the regular electrolytes that could be as low as maybe, or just a simple vitamin B12 injection, it could be as low as like $25.
Okay.
So it just depends what you're getting injected, if you're getting a package and you're doing it regularly. So it just depends on your frequency of what you're getting injected, and then the product that is being injected.
And do you offer any financing options maybe for patients that might be doing something that needs, financing?
So that's been very helpful for us and our patients that want to get certain procedures done.
Yeah.
So CareCredit has been great for us in that regards. There's always credit cards that patients can use, and we do make an extra effort to make things more affordable for our patients. Our pricing is very competitive.
Is there one thing you could tell me that's maybe your favorite aspect of being a doctor?
Currently, I'm really enjoying teaching.
Okay.
So I'm faculty for Allergan, a company that makes Botox and fillers like Juvederm. And so I teach a lot of advanced sessions in seminars, conventions, in meetings, and I get to meet a lot of different people. That, along with seeing my patients, meeting new patients. I love the socializing aspect of it, and I love sharing what I've learned over time. So that's been very rewarding for me.
Well, it was wonderful hearing from you today. Thank you so much for joining us.
Thank you. Thanks for having me.
Thank you for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.